the prostate MR, it's probably best to have the prostate MR before the biopsy. So the biopsy changes don't interfere with the interpretation of the MR. But that being said, you had a biopsy of a low-grade lesion, and MR, even shortly after the biopsy, will be able to evaluate the other areas of the prostate to make sure there's no higher grade lesion. So you don't have to wait 3 months, 6 months to go get your prostate MR. You'll be fine. But optimally, it's best to get the MR before the biopsy, so the biopsy changes don't interfere with the MR. That's our bottom line.
Okay.
All right.
Can I ask one question? Is the MRI like invasive, or is it just the MRI machine that you go into the tube?
Just an MR machine. It's noisy. It's kind of cramped, but other than that, you won't feel a thing.
Yeah. Okay. All right.
So in fact, I just had an MRI today, and it took about 35 minutes. I'm able to be online with you. I'm functioning, and I had a T3, as you know, which is a state of the art for for clinical use. They also have a 1.5. And the reason I did it, I'm doing it before my biopsy, and I'm having what they call a fusion biopsy, which I mentioned to you before.
Okay. Gary, why don't you bring us up to date with what's happening in Orange County?
Well, I am a radiologist at the Hoag Family Cancer Institute and a professor of radiology at the University of Southern California. And I wanted to address specifically people who might have metastatic prostate cancer. I don't know if anyone online falls into that category. However, there is a new FDA-approved treatment for metastatic prostate cancer, and that is called prostate-specific membrane antigen, or PSMA, targeted radiotherapy. The agent's name is Pluvicto. And it is now a new weapon that we can use to treat patients with metastatic prostate cancer. So much more advanced than what we were just discussing. And I wanted to show a few slides if people were able to see them. Here's my slide set. Hopefully you can see a smiling guy over in the upper left, and some pictures, beautiful pictures of the Hoag Family Cancer Institute, the Hoag Family Cancer Center, where I spend the majority of my time. Right? And this is the mechanism. Each type of cancer cell, in this case, the prostate cancer cell, expresses targets. An excellent target on prostate cancer cells is something called PSMA, or prostate-specific membrane antigen. And this is expressed on the surface of the cancer cell. And there are multiple agents that have been developed to bind to that cancer cell, which is great, because once we have this key that can hit the target like a lock into the key, into a key into the lock, we can link it to radioisotopes that allow us to image or treat prostate cancer. These are two of the agents that have been FDA approved to image prostate cancer. So appropriate patients may have one of these PSMA PET scans. And in this case, the radioisotope emits just a little bit of radiation, and that allows us to detect prostate cancer cells in a PET camera. And these days, we just had a approval of an agent now that this radioisotope expresses a lot of radiation. This allows us to bring a lot of radiation right up against the prostate cancer cell by binding to the PSMA molecule and radiate the prostate cancer cell inside the body. This is a trial published in the New England Journal of Medicine, probably the most prestigious medical journal in the world. Of the very first PSMA targeted therapy, demonstrating that patients who received this therapy in blue did significantly better than patients who were on other standard of care therapies here in the orange or red line. And now at Hoag, we have this agent available for patients. In fact, we not only have this agent, which is FDA approved and known as Pluvicto, but we also have 3 other of these little keys that can be used to treat prostate cancer available on different clinical trials. Now, the advantage of getting the one that's FDA approved is you get something that is FDA approved and has been fully evaluated. The advantage of getting on one of these clinical trials and receiving one of these agents are numerous. Number one, these agents are kind of next generation agents that may work even better than the one that's FDA approved. And 2, these clinical trials provide the agent for free, essentially, because the agent is being sponsored by the companies that are making these new agents. So depending upon where you are in your prostate cancer, if you happen to have metastatic prostate cancer or have friends that are, please let them know that right here in Orange County, we have the availability both of the FDA approved PSMA targeted radioligand therapy, as well as multiple clinical trials of additional agents that I'm very excited about offering and may work even better.
Thank you.
Okay, thank you very much, Gary. We'll be posting some of this, and then we'll have you join us more officially as a speaker in the future. We appreciate your coming along with us. Thank you very much, and it's very exciting. This is game-changing for, at least in the time I've been in practice. This is really going to change things for men with prostate cancer spread to anywhere. So this is good.
For metastatic prostate cancer, I think people are saying this is essentially more effective and has fewer side effects than other common therapies like chemotherapy. So yeah, this is very exciting. People are really getting excited about this, and I'm happy we're able to offer this right here in Orange County.
Yes. Very good. Well, thank you for joining us, and we'll be in touch.
Thank you very much, Charles. Have a great evening.
Thank you.
All right, bye-bye.
Thank you.
Goodbye.
Thank you, doctor.